this point in time, everything is seen through the context of COVID. And COVID has had a profound impact on all of our lives, uh, particularly, particularly those of us from a minority ethnic background. Uh, so I'll frame it in the context of the last year, 18 months through that COVID lens. But of course, my pursuit for COVID, for racial equality is wider than that. It is part of what I do, what I am. I work in public health. Equality, equity is what I'm always looking for, what I'm always striving for, what I'm always trying to address, whether it's framed as equity or whether it's framed as inequalities. Uh, uh, so thinking about the last year, 18 months, number of important things. I guess at the start of the pandemic, it was quickly apparent that there was a disproportionate impact on people from a minority ethnic background. And, and that was apparent from listening to the news, listening to the names that were read out. The doctor who died initially from Leicester, so uh, they were all names of minority ethnic people. And that was looked at by the organization that I was working for, Public Health England. There was a national piece of work that looked at the link between ethnicity and COVID-related outcomes. A really good, important piece of work. So that is not work that I did, but it was done by the organization. My role in that was really taking the lessons from that, disseminating that, letting others know about the findings of that work, spreading knowledge about it, what it shows, and thinking about what needs to be done as a result. And at that time, there was really good leadership in the region that I work in. One of the medical directors had set up a group that was specifically with the purpose of addressing the disproportionate impact on minority ethnicities from COVID. And as part of that, partners from across the system, including from acute trusts, from ambulance trusts, from NHS England, from local systems, from Public Health England, from local government, partners from across the system got together. And one of the, and there were several, there were a number of important pieces of work, including things like the ambulance trust looking at their data from where they were getting their call outs, what was the differential impact of that they could see on different communities by deprivation, by ethnicity, and what they could do perhaps to address that, what they could let us know about it so that others could also help address that. There was a needs assessment that we did, trying to bring together all of the data to build up a profile for the different needs of minority ethnic communities. And that brought to us several realizations. Was the fact that there were some identified needs. In some ways, there were different needs for minority ethnic populations. But I guess a more fundamental point was the lack of data about ethnicity. So the number of indicators for which we could not break it down by ethnicity. We could not have that breakdown because ethnicity was simply either not recorded or recorded really poorly. So the need for recording ethnicity was something that came out really, really clearly. And that led to work around advocacy. So advocating for better recording of ethnicity. So if we don't have the data, how can we understand the scale of the problem, what the differences are, and how can we address that then? So advocating for better recording of ethnicity, but also then going on and encouraging all of the local systems in my region to do a needs assessment by ethnicity, to understand their populations, and understand the minority ethnic populations, and understand the differences in health status, and hence as a result, the different actions that need to be taken to address those differences. And that was done by all systems in my region. So that was another advantage of working collectively. We shared all of that learning through webinars, and those are very well attended webinars. The two webinars that we did had over 200 people, so really well attended webinars. And it's really important to share that knowledge, to build awareness, and as a result, a willingness to work towards change. There was also a group set up in the region where I work, specifically to address racial inequalities. And we supported that group in thinking through what are the indicators that should be monitored. Indicators that are clinical, but also indicators that are wider than that, and perhaps indicators for which we don't have an ethnic breakdown, but they're still important to monitor. We need to improve our recording of ethnicity, but there are things that we need to look at irrespective of whether that breakdown is available or not. So helping define a list of indicators that it would be useful to follow up on, to work towards improving. Uh, and then as the pandemic progressed, there was a piece of work in almost in real time, to monitor the differential impact by ethnicity, to see whether the actions that we were taking had the desired impact or not, whether that differential experience by ethnicity was widening or not. So monitoring in real time. But all of this data intelligence, this went back to the board that was set up to take action, and that board had representation from across the region. So some really powerful actions that were taken as a result. So working collaboratively to to identify the problem, surface the problem, share learning, understand our populations, and take action where necessary. So all of that around the COVID response. But equally, work outside of the defined COVID response. So looking at data, and we've been doing data packs on cardiovascular disease for a number of years. So again, refreshing those packs. And although ethnicity is not a clearly defined theme, because often data isn't recorded by ethnicity, it is by deprivation. So looking at deprivation, and there's a close link between deprivation and ethnicity. So identifying those issues, making sure that those issues are examined not only at a regional level, but at system level and at a local level within PCNs and primary care. So shining a light on the problem so that action can be taken. And we've been presenting those data packs, and action is being taken to address those inequalities. Similarly, data on cancer. So again, shining a light on differential experiences of different groups. Ethnicity is not an explicit cut of the data, because a lot of the data doesn't. Ethnicity is not recorded for a lot of the data, but again, there's a close link between deprivation and ethnicity. So shining a light at different levels within the system to enable action to be taken, and advocating, as I said, for better recording of ethnicity. But also wider than that, uh, setting up a dashboard specifically looking at indicators which can be broken down by ethnicity, what they tell us, how we interpret them, and how they can be shared with people who can actually take meaningful action to address what is being shown by those. So that's a dashboard that has been set up, that I've been involved in advising on and setting up. And at a broader level, bringing together intelligence networks. So there are a lot of people doing a lot of good work, and that is spread across different organizations: NHS England, Public Health England, systems, local government colleagues, but also colleagues in provider trusts and ambulance trusts. So building those intelligence networks where you can have those meaningful conversations, come to a common understanding, share that understanding, share our learning, share our approaches, and then make sure that that is presented to decision makers so that there is meaningful action as a result. So those are some of the things that I've been doing in the last year and a half in my pursuit for racial equality.